Welcome back to part 2 of You Ask Doc About vaginal bumps, lumps, odors, and discharge. So, in part 1, I would have concluded talking about skin tags, which again is one of the type of very common and benign growths that can happen on the vagina. Another very common benign growth that can be of concern to some people that I get asked about a lot are what are called vulvar papillomas. So here we'll talk about what they are and what they're not. Let's clear up a really common worry about vulvar papillomas, right? So these are small, soft, finger-like projections. And as I'm showing on the screen, I mean finger-like projections because it sort of projects or grows outwards. And these can appear along the inner labia or around the vaginal opening, right? So they're sometimes called vestibular papillomatosis, but they're completely normal and harmless despite the fancy name. If your provider says it's vestibular papillomatosis, don't worry. It's just a normal variation of anatomy. It's not an infection. It doesn't require treatment. They're not caused by HPV, and they're not genital warts, though they can look similar at first glance. Fast facts: vulvar papilloma versus genital warts. Here's how you can tell them apart. The vulvar papillomas are soft, skin-colored, usually appear in a uniform or symmetrical pattern, often in rows. So it's almost like someone carefully stenciled them and the next one looks like the other and so forth. It's likely to find the female counterpart of this in men, and that in men is called pearly penile papules. That was hard to say. And that's again where there's these little projectile growths in like a perfect symmetric, very organized pattern, which happens around the glands of the penis. Genital warts, by contrast, may look rough and bumpy, often with a cauliflower-like appearance, and they appear in a very random or clustered pattern. Genital warts actually can have a very disordered appearance to them. Next, the vestibular papillomatosis has been recorded in healthy young women in the range of up to 32% of all women have them. Warts are a recognized symptom of genital HPV infections, and 90% of those exposed who contract HPV will not develop genital warts. They're not as common as the vestibular or vulvar papillomas are. Only about 10% of women who are infected with HPV will transmit the virus. Papillomas are non-infectious, completely benign, while genital warts are caused by low-risk HPV and can be spread to partners and may need treatment like freezing or creams to remove genital warts, whereas the papillomas, you don't need to treat them. If you're unsure about what you're seeing, don't hesitate to ask a doctor, ask a provider, a gynecologist. But just be wary that I have also encountered misdiagnosis where patients have been told they have warts when they were actually very benign vulvar papilloma, or what we call vestibular papillomatosis. These don't need to be removed. They're just a variation of natural anatomy. Genital herpes, it's a very common diagnosis. It's a manageable diagnosis, and it's worth understanding what it is. So one of the more common but misunderstood causes of painful bumps, painful is the key here, is genital herpes. It is caused by the herpes simplex virus, usually HSV2, but sometimes HSV1 will also cause genital outbreaks as well too. It's the same virus that causes cold sores. So what does it look like? Typically, you'll notice painful, small, fluid-filled blisters or sores that are often in clusters, so little groups. These can appear on the vulva, in the vagina, on the thighs, even on the buttocks. Some people also experience tingling, itching, or flu-like symptoms just before an outbreak begins. So here's what's important to know. Number one, you can have herpes and not ever know it. Many people don't get symptoms right away or ever. Number 2, it's manageable. Medications can reduce your outbreaks and lower the risk of passing it on to a partner. And 3, you can still have a healthy, normal sex life. A diagnosis doesn't define your worth, your health, or your relationships. Fast facts about genital herpes, what you need to know. First outbreak is often the most severe outbreak. Outbreaks may get less frequent over time if they are treated and managed. The diagnosis can be done via swab if there's active outbreaks present, or a blood test. The treatment, antiviral medications, acyclovir and valcyclovir. These are most important, especially for severe and first-time outbreaks. You may also have a superimposed bacterial infection with your first-time outbreak, so sometimes an antibiotic may be required if there's significant pain, as well as pain medications and anti-inflammatories to reduce swelling and discomfort from the blisters. There's no cure for herpes, but it's very manageable once you understand how to manage it. See your doctor if you've had a few onsets of new painful sores or blisters, especially if it's the first time you're experiencing it. So, the Bartholin cyst gland, what is it, right? What is this that causes this bump for women sometimes? Women have 2 Bartholin glands. If you picture the opening of the vagina, there are 2 in the vaginal opening. If you think about the face of a clock, we have 12 o'clock and 6 o'clock. The Bartholin glands are usually located at 5 and 7 o'clock in the back area of the vagina. These glands help lubricate the area. Sometimes the duct that drains one of the glands could become blocked, causing a fluid-filled lump to form. This is called a Bartholin cyst. It usually shows up as a firm, smooth lump on one side of the vaginal opening. So it feels it feels like this firm lump. It's not always painful. Most of the time, actually, it's painless and not harmful. But as you can see, it tends to happen on one side because one duct gets blocked. So it can happen on both, but it's not very common. If this gets infected, however, it could turn into a Bartholin's abscess, which is painful, swollen, and can require treatment and drainage. So here's the bottom line. A warm sitz bath a few times a day can help drain these naturally. If it's painful, growing, or causing discomfort when you walk or sit, then you need to be seen by a provider. You might need a small procedure and some antibiotics. Now let's talk about when a Bartholin cyst keeps coming back. For some women, the Bartholin gland keeps getting blocked. It's drained, it's blocked again. So even after drainage and it can resolve on its own, it returns. This happens because the duct gradually gets more narrow and scarred over time, making it more likely to get clogged again. If you've had 2 or more cysts on the same side, it's considered a recurrent situation, and it's worth talking to your doctor about longer-term options. The treatment options include sitz bath, which I spoke about, but these need to be done early on. It can help some small cysts resolve naturally. Marsupialization is a minor procedure that creates a new opening for the gland to drain. In rare cases, surgical removal of the entire gland might be recommended, but it's usually if the cyst is a chronic and recurrent issue that's severely affecting your quality of life. You don't need to live in discomfort. There are real manageable options for Bartholin's gland cysts. Now, a common concern I need to clear up. Can a Bartholin gland become cancer? The answer is very rarely. Bartholin gland cancer is extremely uncommon, and makes up less than 1% of all types of female genital cancers. That being said, we take new or persistent Bartholin swellings in women over age 40 and 50 a bit more seriously. If you're over 50 and you develop a Bartholin cyst for the first time, you're in your 40s, it's the first time it's happening, you need to see your provider. A biopsy might be done just to rule out rare causes. Imaging could be done, like an ultrasound of the area, an MRI, or close follow-up of the lump if it doesn't go away. But most of the time, it's still just a cyst. Checking it out is just a smart step to take. So not every bump means it's an STI, but some do. The rule, if it's painful, new, doesn't go away, get it checked out. If you find a sore, especially if it's painful, it doesn't heal after a few days, or is accompanied by swollen lymph nodes or an unusual discharge, you should absolutely get that checked out. Herpes is the most common cause of genital ulcers worldwide, but other conditions can mimic it, which is why a proper diagnosis matters. Sometimes a simple swab or blood test is all it takes to find the answer and get treatment started. Other causes of vulvar sores include primary syphilis, which is a painless ulcer or canker sore, chancroid, which is rare in most countries, which are painful clusters of ulcers and inflamed groin lymph nodes. LGV or lymphoma granuloma is an STI caused by strains of chlamydia, and it starts as a small sore and progresses to these really painful swollen lymph nodes. Behçet's disease is an autoimmune non-STI cause of recurring mouth and genital ulcers, along with eye and joint symptoms, and that's a tough one to diagnose sometimes. Lichen planus is an inflammatory skin condition that causes raw, eroded patches of skin and painful sex, itching, pale white streaks in the vagina. Then we have fixed drug eruptions, which is a rare reaction to medication, like specific types of antibiotics and some anti-inflammatories that happens in the same area every time you take the medication. And finally, trauma and friction, rough sex, aggressive hair removal, and tight clothing can cause skin changes, but these would usually improve quicker than the rest of the examples I would have given. So, red flags when to see a doctor immediately. Painful or painless sores that last more than 7 to 10 days. Fevers, body aches along with the sores. Ulcers with a foul odor or pus. A new sexual partner, and you're unsure of your STI status if you've been exposed to anything. Recurring ulcers and unexplained skin changes. So here on these two images, I just found it important to point out what could happen when you are not sure what your issue is and why you should be seen by a medical professional. One of these pictures, where you see the red areas and sort of these little blistered areas, actually is vulvar candidiasis, which is quite advanced in this case. This person was probably experiencing a lot of discomfort, burning, itching, but yeast infection. This is easy to fix. This will go away within a few days of being on treatment. There is actual primary syphilis. Here you have an isolated ulcer, ulcerated skin. It looks like the skin is sort of scooped out. It has a little inflammation, that little purulent or pus around it. Syphilis is actually painless, and it's something that requires treatment, testing, follow-up. You don't want to get secondary and tertiary syphilis. Huge difference between the two, which is why if you're not sure what you're seeing, you're not sure what's going on, it's important to seek professional help. Genital warts or HPV genital warts, I think is important, and this is what you need to know. It's another type of bump you might see in the vulva area, and genital warts are caused by certain strains of the HPV or human papilloma virus. I mentioned them earlier before because there's a benign change in the vulva, which is called vulvar papilloma, that are often confused with genital warts. Genital warts can appear on the vulva, the vaginal opening, the anus, or even inside the vagina or cervix, and they might show up as a single wart or in small clusters. Factors influencing genital wart rates in women. Age. The incidence is highest in younger women, age group 14 to 25. Sexual activity. The more sexual partners a woman has, the higher her risk. History of STIs. Women with a history of other sexually transmitted infections are at increased risk. HPV vaccination status. So vaccination with the HPV vaccine, especially at a younger age, usually starting age 9 to 11, can significantly reduce the incidence of genital warts. And this is according to the National Institutes of Health, or NIH. Your immune status is another factor. Women with weakened immune systems, for example, if you're HIV positive or more susceptible for other reasons in terms of your immune status, the genital warts can be a more frequent occurrence. Smokers, right? So cigarette smoking, tobacco smoking has been linked to a higher likelihood of reporting genital warts, and this is according to the Oxford Academy. Now, fast facts you should know about genital warts. Genital warts are caused by certain types of the HPV virus. There are over 100 different strains, known strains of the HPV virus. Most commonly type 6 and 11, which are considered low risk, are linked to genital warts. And low risk just means they don't cause cancer, but they could be quite annoying. Genital warts usually appear as flesh-colored or pinkish bumps. They can be flat or they can be raised and bumpy. As you see here, sometimes they look like cauliflower, and they can occur isolated or alone, but usually they do spread to become these clusters. Most warts are painless, but they can cause itching, discomfort, and irritation on the skin, especially if they're growing and rubbing against clothing. They're not dangerous, but they can be annoying, as I said. Yes, they're contagious. They are contagious. They're contagious through skin-to-skin contact, usually during sex, but not always. And they're not contagious through bodily fluids like semen or blood. It's the skin. While HPV also can be transmitted via non-penetrative sexual activity, this is less common. The virus lives in the top layer of skin in the genital area, and it can spread when the skin of one partner touches an area infected with HPV. Even when there are no visible warts, this can happen because the virus can still be present in the skin. So even with condoms, HPV can live on the nearby skin, like the groin and inner thigh area. So yes, genital warts are contagious even if you don't see them, and even if the infected person has no idea they have HPV. This is why the virus is so common. Treatment options include freezing them with cryotherapy, prescription topical creams, laser removal, or surgical excision, depending on their size, number, and location. Warts can show up weeks, months, or even years after the HPV exposure has occurred. 90% of HPV infections, however, are cleared within 2 years of exposure. That's a good statistic, and this is possible. So it's possible for this latency window of time, or latency period, to occur between the first exposure and when the actual occurrence happens, and sometimes it can happen years later. Warts can recur. This is most seen usually within the first year after treatment, because HPV can remain dormant in the skin cells even after the visible warts are taken away. The HPV vaccine, like Gardasil 9, can help prevent most cases of genital warts, and also protect against HPV high-risk types, which cause cervical and other cancers. About 30% of genital warts will disappear within 4 months of their initial appearance. Recurrence rates depends on the overall health, right? Your overall health and your immune status. Previous HPV vaccination, sexual frequency, exposure to infected partners, use of condoms, and so forth will impact your risk. HPV virus also can be found in children, right? Children and genital warts. Anal or genital warts may be transmitted during birth, and this may be sometimes, in a few cases, an indicator of child sexual abuse, unfortunately. Genital warts may sometimes result from auto-inoculation, and that just means where the warts are sort of located in one area in your body, And you can use your own hands, to transfer it to another area as well too. So it's important to sort of wash hands, keep hands clean, especially when you are treating the area with topical medications. If you already have genital warts, is it too late for the HPV vaccine to help? I've been asked this as well, and the answer is not necessarily. The HPV vaccine doesn't treat existing warts or clear current infection. It's not treatment, but it could still offer protection against other types of HPV that you haven't been exposed to yet. The most common vaccine, for instance, which is Gardasil 9, protects against 9 strains of HPV, including the 6 and 11, which can cause genital warts, but also 7 other high-risk types linked to cervical, vaginal, vulvar, and anal cancers are covered by that vaccine. Even if you haven't, if you've already been exposed to one type or 1 or 2 types, you may still benefit from protection against the others. That's why many providers will still recommend vaccination, and you can get it up to age 45, even beyond that, depending on your risk factors, especially if you have a new or plan to have a new future partner. Vaginal odor, what's normal? Normal vaginal odor can be musky but not overpowering, and it varies depending on the cycle, where you are in your menstrual cycle. Also sweat, sexual activity. Non-sexually active people will have some normal variations. What's not normal is if there's a fishy, metallic, or rotten or unpleasant scent. Common causes would be bacterial vaginosis, which causes a very pungent, fishy odor. Trichomoniasis, again, a fishy, foul odor. A forgotten tampon is one I put on my list there, because I see that from time to time. Fortunately, not often, but it could happen. And that has more of a rotting scent, a very foul scent. And then yeast, I will mention, because yeast usually does not have a smell, but it will have other symptoms with the abnormal discharge. Your vagina has a natural scent, just like your armpit, just like your breath. But if something smells really off, your body's probably trying to tell you something. So when to see a provider? Discharge with itching or burning, not going away, you need to be seen. A sudden change in your natural odor, probably it's time to get a checkup. Bumps or sores that are painful, new, or recurring will need some form of professional evaluation. Bleeding in between your periods, bleeding after sex, again, not considered normal, needs evaluation, and painful sex as well too, because all of these may indicate there may be something going on. So here's the bottom line. If it's new, uncomfortable, and it's not going away, see your doctor. No need to self-diagnose, no need to stay anxious about it, just get the facts. Our bodies are smart. They give us clues when something is off. And they also go through lots of normal changes we don't always talk about or know about. If this video helped take some of the mystery out of vaginal health, give it a like, subscribe to this channel, and share it with your friend who might need to hear this information as well. So that concludes this month's episode of You Ask Talk About. Thank you for your time. Thank you for the engagement. Thank you for the questions you received on last month's episode. Keep posting your questions under the episodes and we will answer them. And it's a great place to also allow others to learn from the answers that are provided. And look forward to seeing us again next month for another episode of You Ask Talk About. Thank you. If you need some help with your decision process, feel free to book an online consultation with me. It's quite easy to do so via our website. You'll find all of our information linked in the description below. Looking forward to chatting with you. Take care.